We're here in Mission Viejo, and thanks for Blake and Z System for organizing this event. Today we're going to have Mark to have a zirconia Z Systems one-piece implant placed on the upper right side of his mouth. He had a sinus graft done on this side about 8-9 months ago, and the sinus graft area has healed, and he's missing teeth number 2 and 3 and 4. We're going to replace just tooth number 4 today, and in the future he's going to have tooth number 3 replaced as well. Well, thank you, Mark, for coming today. And he has an implant in area number 5, which is a titanium implant. Had a little peri-implantitis, and we did a little surgery in that area as well, and that healed and looks fine now. And we're going to save that implant and just place a zirconia implant, which is a superior implant, more superior implant than titanium, next to it in area number 4. Mark, do you have any questions, any concerns?
No.
Okay. He also had 3 zirconia implants placed on the left side, upper left side, last year, and they're all doing well. Do you have any issues with them?
No trouble at all.
They're all working very well. So he had a few titanium implants over the last 10-12 years, and some of them failed and had advanced peri-implantitis, and we gradually replaced them with the Z Systems zirconia implants, and they're all doing very well. So hopefully he won't have to go through this again, but the Z Systems implant, the zirconia implants, are holding up great, and it's going to stay there for him for life. All right, so we're going to get started in a minute, and I have Deidre here helping me today, and she's been my surgical assistant for the last few years, and you'll see the coordination of the assistant and the doctor and the patient helps to get the surgery going more smoothly.
So let me ask you a question. You had titanium before and you went with zirconia. What makes you go with zirconia implants, and why do you find it superior and more successful in your clinic by going with this type of implant?
Sure. I've placed over 7,000-8,000 titanium implants in the past 25 years.
Wow.
And about 6 years ago, I noticed that some of these cases are coming back with peri-implantitis. Could be because of occlusal trauma, cement retention, titanium sensitivity, alloy sensitivity in the titanium. For any number of reasons, about 10% of the cases were coming back with spectrum of mild to advanced peri-implantitis, and these cases either had to be repaired, meaning try to save the implant if it was mild peri-implantitis, or they had to be removed if they were advanced peri-implantitis. And I found out that zirconia implant is a better alternative, is a viable, superior alternative to titanium, because it's biocompatible to the gum tissue. It does not attract plaque, so it shows less inflammation or no inflammation at all, as you will see in some of the slides later. And it's also inert, and so it doesn't have doesn't show any titanium or any metal sensitivity or any sensitivity to tissue that titanium has. So because of that, it's a better alternative to titanium.
So you really, aesthetically too, you see better results as well. Just
Definitely.
From the color of the implant.
Exactly.
But also
Exactly. Functionally, you see a lot better results. Aesthetically, it's a huge difference.
Yeah.
In the cosmetic zone, with the titanium, you see a shadow of the metal showing through the tissue or through the bone. And that's a concern with a lot of patients. In the past, I had so many patients came back to me, can you do something about the metal shadow showing through? And ever since I started doing the zirconia implants, I offered that option to them. And all those patients don't have any concerns or any issues with any metal shadowing through, any dark shadow showing through the gums anymore.
Truly amazing.
Yes,
That's
it makes a huge difference.
So we're placing a Z Systems zirconia one piece, you said?
One piece, Z5M.
Z5M, okay.
Right.
Very nice.
Does the CAT scan show, does the screen show here?
Absolutely. We can
Okay.
show that.
All right. So as you see, he had quite a few implants over the years, and we're working on the upper right side. Here, if I show you the X-ray on the upper right side, this was taken.
Just a little for us.
Okay.
Perfect. Thank you.
So this X-ray was taken last year. He had another titanium implant that was taken out, and this other titanium implant that's existing there, it's number 5. This implant showed some angular bone loss on the mesial and distal, which is a mild to moderate periimplantitis. When I was doing the sinus graft last year, I also did some osteoplasty and saved this implant, and that pocket resolved in that area. Now, what we have is this X-ray that doesn't show the angular bone loss any longer, and it shows bone graft in the sinus. And we're going to place one implant in area number 4 here, a zirconia Z Systems implant. And I'm going to show you the CAT scan here that shows the sinus grafted on the upper right side, and the implant that's going to go in there. In the future, he's going to get tooth number 3 and 31 replaced, upper and lower. And as you see here, he had 3 zirconia Z Systems implants placed on the upper left side to replace these teeth, which used to be titanium implants actually. And he has another titanium implants in the lower left that's doing well as well for now. So he's been a patient of ours for 12 years, and gradually going to have all titanium replaced with zirconia implants.
Perfect. We look forward to tuning in, and everybody watching, if you want to send in your questions, and if you have any questions for Dr. Manesh, please feel free to chime in.
Okay, so we're going to put our mask on.
I'm going to give you some sunglasses to put on, okay? Just to block the light. Here you go. We're going to start with rubbing some gel in there to kind of help with the getting you numb, okay? Go ahead and lean your head up just a little. Perfect. You're going to go ahead and lean it back.
Okay, Mark, we're going to place a little topical on the upper right side first. So this surgery is going to be flapless, since he has a wide ridge in that area and enough keratinized gingiva, so we do not have to flap the gum in order to place the implant. I'm going to feel, let a pinch here. Great, you're doing great. How you doing there?
Just
Right.
tilt it down just a tad. Perfect. Just a tad more. Okay. Perfect.
Close. Go and open big.
So we're going to place a little anesthetic on the palatal. Turn towards me, please, Mark. A little pinch right here. This is a tough one. Just hang in there.
Doing great. And go ahead and close down. Great. How are you doing, Mark?
Great.
Great. We're going
All
to
right.
stop just a minute to kind of soak in, okay? Alright, go ahead and put your good. Yeah, alright.
in. Streaming started already. Okay. Can I use my light or not?
What size is the implant?
Probably 4 by 10.
Okay, 4.
Or 4 by
So what size implant will you be placing here?
10. A 4 millimeter Z5M by 10 millimeter length. 4
Okay.
millimeter diameter by 10 millimeter length.
And what is it about this system that you find so unique that you know, stuck so much with that implant system? Because you place a lot of the
Right.
Z systems, correct?
Exactly, yes. I started placing Z systems about 2.5 years ago,
Oh,
and
wow.
they've been working great for me. The Z systems, there are a couple of elements that make it a great implant. One is the modified surface by laser, the SLM surface.
Okay.
That makes it integrate faster and better, so you get stronger integration. The second item is the polished surface in the color of the implant. That makes it to have a healthy tissue around it, and being one piece. I like the one piece, and the two piece works great. I've done quite a few of the two piece implants. The one piece gives me some flexibility, and I place them in, and sometimes they have to be temporized with a temporary crown or an SX, or sometimes you just leave them in the posterior, and then 2-3 months later the crown is placed over it.
Very good. We're learning a lot today.
Right. Any questions coming in? Yes?
We had one asking if they were placing another titanium implant or a zirconia implant, and someone had already responded, I believe.
Okay.
You want to reiterate?
The question was if we were placing another titanium implant?
Yes.
No. We're phasing out his titanium implants.
I think
He has
they,
2 more left.
Joined late. Let me
Yeah.
get your mic set for you, sir.
So he had 3 titanium implants on the upper left side, and 2 on the upper right side, and 2 in the lower. The 3 on the upper left were replaced with zirconia implants last year. The ones on the upper right, there is 1 left, which is doing okay. We're going to leave it alone, and we're just adding a zirconia implant in there today. And the ones on the bottom, the one on the bottom left is doing okay, so we're going to leave that alone as well. But my guess is that the titanium implants usually break down 5 to 7 years after placement. So.
More, okay, so you're not going to fall out, but it is going to feel like you're going upside down. Yeah, I'll adjust it. Just let me know when it gets.
We're looking at it. Oh, that's a smidge. Just
Up or down?
down.
Right there.
All right, let me have a lighter, please. Open wide, please. Any other questions coming in?
Close now.
Not yet. I'll ask them as they come in. We got someone watching.
Great.
So over 95% of my practice now is zirconia implants. And
95% of your practice is in zirconia implants.
Yes.
Wow.
And almost all of them are zirconia Z-Systems implants. Turn your head towards me, please. Open wide.
And this is a unique system because they use a ceramic drill, correct?
Right. They have all ceramic drills. which helps because they don't go dull after, the titanium drills, you have to replace them after 15, 20 times
Yeah.
of using. These, I can use them up to 80, 90 surgeries and still be okay.
Wow.
That's the nice thing about ceramic. Open wide, please, Mark. So, as you see here, turn away, please. He has sufficient keratinosis gingiva here, a wide ridge, and we can easily place a zirconia implant flapless here. You can use a guide to mark this area. So if you use a guide, you have your lab make a guide, and you'll know exactly where the tooth will be by Denmark.
When you use a guided surgery with this zirconia system, what do you use? What's the surgical guide that you prefer?
There are a couple of companies out there. One is 3D Diagnostics.
Okay.
That's local here that we can work with. And there's another one, MIS. Dr. Fields works with MIS. That's
Okay.
a good one as well. And there are a couple other ones in the market that they do very well, and they're very low in the price. So you
Very
don't have to
nice.
spend a lot of money on that. Typically, I do one or two implants freehand. I don't use guides. You can, especially for the beginners. It's a good idea to use guides.
Yeah.
But for experienced people, they can use the freehand, do their surgeries freehand. So I can use one of the delivery instruments just to create a little mark to see where I want to place my implant, and have a little projection so you get a little image of the crown and how it will be projected occlusally, and that helps to do. And then with your probe, you mark in the center of that marking in the gums, and then you do a little measurement to check your distance next to the other implant or the other crown. So he has a large premolar on this existing titanium implants. So we're going to do another zirconia implant next to it, probably similar to the size in the crown. So you can do your marking right through the gum with the smallest drill. Does it show? Mm-hmm. Okay. No, turn away, Mark, please. Thank you. Open wide. So you check your angle while you're placing the drill in the mouth. Buccolingually and mesiodistally, you want it to be mesiodistally, you want it to be parallel, and buccolingually, right in the center. And you just go right through the gum, through the gingiva, and you go down about 6 millimeters into the bone.
Now, to what depth will you drill into the osteotomy for a 10 millimeter implant?
First, you drill down to 6 millimeters, and
Okay.
then you check your parallelism with the paralleling pin. Open wide, please. You can put in the same drill in the mouth and just check your angle and your direction. And you just look at it, and if it's parallel to that implant, and if it's in center, as far as center of the ridge, and to the adjacent teeth, then looks good.
If you can move your hand down just a little bit, please,
Here,
so we can
put it
see.
back in there. So
Beautiful.
as you can see, you can check everything here, and to make sure everything is okay.
This
This is the best tool. If you don't have a surgical guide, this will be your guide.
Yeah. And that's the ceramic drills you're using here, these white drills?
This was the smallest drill.
Okay.
And then we'll go to the 230 drill,
Okay.
which is the 230.
So it's a truly ceramic system from drills to implant. It's
Yes.
fully ceramic.
Exactly.
Amazing.
Open white vein. So when you go flapless, you have to take into account the thickness of the gingiva, which is about typically 2 to 3 millimeters. So whatever depth you go to, just add 2 millimeter minimum to it to take into account the height of the gingiva. So let me show them first. So then after you do the pilot drill, the 230 drill, you put your paralleling pen in there, and you check the angle one more time to make sure the angle is okay. And you can also take a little probe and check the distance from the center of the adjacent tooth to make sure that's correct. And you check to see if it's in the center of the ridge and center of the fossa of the adjacent teeth. And then we'll take an x-ray.
Perfect.
All right, Mark, so we have that guide put in there, and I'm going to go ahead and take a picture of it like I was telling you.
Any questions coming through?
Place this on over you.
We're all talking to each other. These systems happen too.
I'm going to take the
Go
x-ray.
go
Oh,
ahead.
you're good. Okay, Mark, I'm going to have you bring your left hand up once more. Go ahead and open. Right, don't, yeah, right there.
Maybe you could talk about the radiograph
Just like
and what
that.
it's like
Down,
with a
just over.
ceramic implant compared to a titanium.
Radiographically?
Okay,
Yes, right?
great.
Right. Let's take this x-ray and then we'll talk about it.
Open, you can take it out. Thank you.
So radiographically, the titanium, the zirconia implants show a radio opaque, complete white radio opaque image on the X-ray, and the Z5M, which we'll see later, will show as a solid cylindrical with threads parallel. And because it's one piece, it will show the abutment right attached to it. There's no micro gap, and so there is no concern about bacteria getting into the gap. Now, as you see on this X-ray, the pen shows that it's parallel to the adjacent implant, and you can see the depth. It's right into the sinus area where it was grafted, and the bone looks very good, as we saw in the CAT scan. So we just move on to the next drill, and we take it to depth.
I'll take it out.
Yeah.
What's that?
Now, with this ceramic implant, these ceramic drills, do you have a different motor speed or hydration that you do? Is there any difference in that?
The irrigation is the same.
Okay.
You make sure you have irrigation system with your motor. The speed, I usually keep the RPM around 400 RPM
Okay.
for the upper, a little bit higher for the lower because the bone is more dense in the lower jaw.
Okay.
Maybe about 600, 650 RPM in the lower jaw.
But nothing really high, like 800, 1200 speeds.
You don't have to.
Yeah.
No. With the pilot drill, you can go 1200 just to go through the bone, and then from that point on, you can bring it down to 600 or 400.
Okay.
So for the upper posterior, I usually go to 400 RPM. That's more than what you need.
Yeah, lots of hydration and low
Well,
speed.
yeah.
Okay.
Oh, turn away, please. Open wide. So you just go right into the osteotomy, and you make sure you drill to the depth. Since we're going to do a 4 by 10, so we have to go to 4 by 12 millimeters. Remember, there's 2-3 millimeter of the gingival height, so we go down to 12 or a little bit past 12 millimeter on the markings of the drill.
So you go about a half millimeter to a millimeter below the implant length into the bone, into the osteotomy, correct?
Well, for the 12 millimeter, for 10 millimeter implant, the marking on the drill is at 11. So I go to 11 and a half, close to 12.
Okay.
Yeah. but you have to take into account the 2 millimeter gingival height because it's flapless.
Okay.
Open wide. I put the drill extension because the drill couldn't get in all the way, so this is just a drill. Open your mouth, please, a little wider. And with this, you can get in a little bit deeper. So this is our second drill, which was a 285, and TD 285. Now we just go to our last drill, which is a TD 325. And then we do a countersink. Turn away, please. Open wide. A little wider. Thank you. You just make sure it's parallel every time you take the drill in the osteotomy, so you don't go at an off angle. So, and our last drill is just a countersink, which is the red one. With the Z Systems drill kit, it's very easy. You just follow the L shape for the 4 millimeter. Open. Because it's flapless, you take the countersink in to the osteotomy deeper than what you would do when you flap the gum tissue.
So this, you're making room for the collar of the implant?
Exactly.
Okay. So you're just expanding that cortical plate
Yes.
out, flaring it out a little.
Yes, exactly.
Okay.
Right on. Yes. And because this was a soft bone, it's a sinus grafted bone, you don't have to use it tap.
Okay.
Normally in the lower jaw, I use a tap.
More dense bone.
Yes, more dense bone, you use a tap.
Okay.
For the upper jaw, upper posterior, typically you don't have to use a tap, especially when you feel it's soft. So let's get a 4x10 Z5M. And you put your motor on a 20 Newton centimeter RPM, and you have your assistant open the implant for you, and you take this, and you peel off the top, and you just place this delivery system over the implant.
We're about to place the implant, so I want you to, when I let you know, I just want you to open as big as you can and stay
And hold it over your surgical site in case the implant comes off, it still be sterile. And turn away a little bit. And you just very carefully and slowly open wide. You place the implant into the osteotomy right there. And then you start the motor. And you make sure your angle is okay. And you can see the blood streaming through the threads. That shows that this implant is hydrophilic. And the tissue, the blood, the body loves it. So it goes right up these threads. And it will give you very nice integration.
That's amazing.
Yes. As you can see, it's very simple. Very simple procedure and steps to place the implant with your handpiece.
It's not a very complex system. It seems like it's very fluid and simple to use.
Exactly. And the last couple of spins at the end, I just use my torque instrument, and place it over. And you take it to the gum level, flush at the gum level, or you can do it about 0.25 or half a millimeter subgingival if you like. And you can bring the flat surface facially, and you have the patient bite down. To check the bite down. You can see there's enough clearance. Can you see that?
A little bit down on your hand, if you could. Perfect.
So
Beautiful.
You can see the clearance there.
Wow.
You can see it's parallel, is occluding with the opposing tooth, and there is, hold this here please, and there is about 3 to 4 millimeter,
D, could you retract it down more towards his chin?
3 to 4 millimeter clearance interocclusally, and that's what you need. You know, you need about 3 millimeter clearance if you can.
It's beautiful.
And it's flush at the gum line. The margins is right at the gum line flush section here. And very simple. Place it in.
That was easy.
It was easy. It's torqued to about 20-25 newton centimeter, and we're done.